Today's topic is about interceptive orthodontics for children. This is also commonly known as early orthodontic treatment for children who are in mixed dentition or developing dentition. So we typically would advise an orthodontic assessment for children who are in mixed dentition or developing dentition,
who might need early interceptive orthodontic treatment more over the others. And if need, when is the best treatment time?
And this is roughly around the age of 7 to 9 years old. The child's development varies from child to child. There might be some children who reach mixed dentition earlier than others. And also between genders, more commonly girls would actually develop a little bit faster than boys. So girls might be more eligible for interceptive orthodontics a little bit faster than boys. So of course, this would only be determined during your dental visit with the dentist. So some of the common early orthodontic problems that we see in children are anterior open bite, and this is often caused by thumb sucking or pacifier sucking. Also, we see people with anterior cross bites or with posterior cross bites, or sometimes they might have what we call an excessive overjet or overbite. And these are issues that we can try to solve by having interceptive orthodontics.
How would be a comprehensive orthodontic evaluation and some of the early treatment look like?
So during the orthodontic evaluation, we would have to do a radiographic assessment by taking some radiographs to determine if the child is suitable. And we would also have to do a dental assessment to assess the teeth as well as to assess the jaw relationship. And also we will have to assess if the child behaviorally is ready to accept treatment as well. Interceptive orthodontics, what we call phase 1 orthodontics, because more often than not, the child might actually still need phase 2 orthodontics. And it's what most of us know more commonly as braces or orthodontics for permanent teeth. Early orthodontics, or what we call interceptive orthodontics, is quite often used to correct certain functional issues. So some functional issues might be due to persistent habits that the child has since young, and habits such as thumb sucking, even into the ages of 7 to 8, or perhaps pacifier sucking, or even lip biting might cause these functional issues. And so early orthodontic treatment might help to address these issues and help the teeth return back to its normal position. Of course, the habit will need to be stopped as well. Otherwise, the teeth will relapse and go back to what it was before when the habit was ongoing. So for certain jaw relationships, interceptive orthodontics might be useful. For patients with underbites, where the lower jaw is longer than the upper jaw, sometimes we could employ the use of a face mask to help to correct the jaw growth. However, this also depends on the pre-ortho assessment, for we can determine if your child is suitable. Also, some children with anterior cross bites would be suitable for interceptive orthodontics, especially if the one upper permanent incisor is stuck behind the lower permanent incisor and causing the permanent lower incisor to be mobile or causing gum recession. Correcting the crossbite would help to prevent the lower incisor from becoming loose or from having gum problems. So space maintainers are also a form of interceptive orthodontics. So for example, if the tooth has been lost early due to perhaps trauma or dental caries, we can always put a space maintainer to try to maintain the space so as to allow the permanent successor to grow into the space. Interceptive orthodontics is quite commonly called phase 1 because this is typically just a functional treatment where we try to treat certain functional habits or functional issues that are causing the malalignments. After that, once the child is in permanent dentition or has completely changed to permanent teeth, phase 2 might be required to correct the crowding, and this is typically known as conventional orthodontics. Hope the sharing today is useful, and thank you for listening.